Today's webinar is going to be about Stella BioDevice. So it's a combination of EMG and electromuscle stimulator. Maybe in few words, why we came up with the Stella BioDevice. That device, you've been always asking us in regards to Luna, like, can we have electrostimulation during the movement? Could it be functional? Maybe it could be a little bit smaller. Can I take it to the patient's bed? And all those things that you were saying, all the feedback from the physiotherapists or distributors were taken into consideration, and we've been working on this device for some time already, because there are things that comes to our mind and we implement them. Obviously, it's also needs to be registered as a medical device, which is at this point, and a lot of work has been put into the creating a device. So so this is how we came up with the smaller version of Luna, but using this EMG triggered electrostimulation instead of using EMG triggered robotic movement. And we add some other features into this device as well, and I would like to shortly tell you what it's all about. So first of all, what is it, like what the set contains? So we came up also with a set that we would like to implement to the clinics, so it's easier, and also for you as demo devices. This is what the set contains. So basically, it's a Stella device itself with a 6-channel cable, and there are 4 channels for surface EMG or electrostimulation and 2 for pelvic floor electrodes. 2 because we can use 2-channel electrodes for pelvic floor therapy. So that's how it goes. And 4 surface channels also because the software contains programs for functional electrostimulation, and you need at least 4 channels for some of those. So this 4 + 2 channels is really for you to be able to use all the software which is right now at this point developed. And then there is, in the suitcase, we also have the charger, we have 2 batteries, and we add as a start version 1 package of EMG electrodes, the same which comes with Luna, and 2 packages of electrostimulation electrodes, which are 5 per 5 centimeters. There's also a very nice belt. So if you're going to a patient, you can actually stack the device on the belt. In the demo version, in the version for the clinics, we add laptop with the software pre-installed on the laptop. So then it's even more easy, because Stella has been developed to work as a web-based device, which basically means you can operate Stella on any kind of device. But of course, the clinic right away would like to have a device with it, right? So that's our idea for the package. And we also add, if needed, the router to it. Because if the clinic has a Wi-Fi, then they don't need a router, but if there could be some issue with that, we can add this to the package as well. Okay, and just to show you a little bit closer what is inside the suitcase, and so that looks like this. And I pre-recorded some of the already videos before, just to show you it a little bit closer. So the EMG electrodes, like I said, are the same as in Luna, and we do exactly the same operation with attaching the electrodes. But you can also see that on the channels, there are colors and there are numbers of the channels, and also there is plus and minus. So for electrostimulation, we know which electrodes put in which place. So this is new, right? Those electrodes, very good electrodes, and they are really great for functional electrostimulation. They're adhesive electrodes. You can actually use them. You need to use them with the same patients, but you can use them up to 20 times. You can slide it a little bit, like water it with water, so it's the glue is better, and use them up to 20 times. And also the suitcase has this nice feature that the cable comes from here. So you can actually put the cable into the charger and put it back into the suitcase. So that way you can actually charge the batteries like having everything in the suitcase, right? Because at the back, you will see this hole that you can slide the cable from the charger, and that way you're able to charge the batteries. Yeah, so that's the USB charger that comes with the set, and this is how you can actually charge the batteries. So everything is like really neat and nice. So because you have two batteries, right? So one is in the device and the other one can be in the charger. So then you always have charged battery. Okay. And there is MDR cable that you just plugged into the device, and yeah, and you work with the device. You can see this nice lettering that is so common for our devices, right? So Stella is like a smaller sister to Luna. And also the belt that I was mentioning, also very nice thing in the set that you can just add it on the belt, and this is how you're taking it off. So also a very nice feature. There is one more accessory there that if the cables are, if you have any troubles with keeping them organized, then there is additional thing that you can put the cables through that, and it also goes on the belt. Okay, so that's a part about the hardware. Let's now go through the concepts that has been implemented in Stella. So the main and the most unique one, this is EMG triggered electrostimulation or functional electrostimulation. I think that what is very nice is that the EMG is very sensitive in Stella, and the electrostimulation can be applied very, very nicely into the functional pattern as well. I will show you that later. Of course, if we have electrostimulation in the functional way, we can use it also in the normal way, like it's like a normal electrostimulator. And also it can be functional. But then you don't start it through EMG, you just start it and the program goes. There is EMG biofeedback as well, as you know it from Luna already. And we add electrostimulation based on the TENS, which is very good for pain relief. And the first concept, the EMG triggered electrostimulation, is pretty simple. So we choose a channel that will activate the sequence of electrostimulation in the functional matter, right? So why we went this path? EMG triggered electrostimulation has a very nice literature background, protocols. And the study already showed that it's effective for post-stroke protocols. It's more effective than non-triggered electrical stimulation. And this study was done on the hand function of patient after stroke. And it's more effective when it combines with tasks. And of course, you need a cognitive involvement by the motor cortex here, which is also how we proceed with LUNA, right? We want the patient to be active during those procedures. And there has been studies with the EMG triggered approach. And for example, it was a group of stroke patients, and there was treatment during 3 weeks. It was done at home on stroke patients, and the EMG triggered functional electrostimulation group had better improvements in tests like box and blocks, with the finger extension strength, motor activity log scale, Jobson-Taylor hand functional test. So all those measurements were better in the group that had EMG triggered electrostimulation. Yeah, the control group were just told they have a current, but they actually did not have that. They just had some kind of light going on. And the programs that we've implemented in Stella Bio in terms of functional electrostimulation are 4 programs: grasp and release, open and close, hand to mouth, and arm extension support. So in the software, you also will have a step where the software shows you how to put the electrodes on each of those programs. So you can see on the picture that you have the color, you have the plus and minus, how to put it. So it's quite easy to select those muscles. And so for example, here, hand to mouth application. So this is the hardest application because it contains 4 channels, right? So here you can see I'm doing the movement here, but it's actually only electrostimulation, right? I don't add any voluntary activity from my side. Of course, in the EMG triggered electrostimulation, I will, or the patient will try to activate this sequence by activating selected muscle. Usually it's the forearm. So the patient needs to activate the forearm, and then the hand to mouth application comes. Yeah. So that was the 4-channel functional electrostimulation. This is 3-channel EMG triggered functional electrostimulation. So basically here, the electrodes are on the forearm, from like both sides, and then also on the flexors of the fingers. And this application is called open and close. So the patient, through electrostimulation, we will open his arm, then there's a small pulse, and then we will close the hand. So also you get this question a lot probably from the clinics, that what do you have for upper limb, right, for the hand, because that's a really common problem with the stroke patients. Another application is called grab and release. So we use the same electrodes here, the same application, and we started from the forearm as well. And first you have opening and then closing right away. So you can open the hand, grasp something, and then release. And that's, again, only electrostimulation, right? I didn't add any of my voluntary movement in it. This is how the electrostimulation helped with that. So the only thing that you need to focus here is on to correctly put the electrodes on and add a good amount of the current, of the amplitude of the current. And we have a very nice application. It's 3-channel application that you use to stand up, for example, where that there is upper limb supported through the electrostimulation, right? So here we have the forearm application, there is electrodes on the triceps, and there is electrodes on the back of the deltoideus. So you train with your patient how to stand up from the bed and to push themselves from the bed. That's actually a very good application because you are using quite big muscles here, like triceps and the forearm. So really it catches the arm very nicely and can be also work with the stroke patients on this. Yeah. And then there is this very easy application that you can, for example, whatever you will show Stella to someone and you want to explain the concept of EMG triggered electrostimulation. There is this program called EMG one channel functional electrostimulation. So you only put the electrodes on the forearm, and whatever patient is trying to extend the forearm, he will receive the electrostimulation from the electrodes. So we will really work on the extension of the forearm. So it's the easiest way to show the approach of Stella. Okay, so that was the first concept. And now we go through the second concept, which is electrical muscle stimulation. I think what is the most important thing to understand here is that electrostimulation works a little bit like an exercise, right? We are familiar with all those EMS gyms at this point, and this is exactly how the current works. So basically what we can program in the software is the how we want the contraction to look like. So we can put the time of the contraction, we can put the time of the rest, but we can also set the ramp of the amplitude of the current. So how it goes up and down, what is the time that it will actually contract your muscle. You can set the frequency of the electrostimulation. You definitely should try on yourself. You will feel the frequency that it's like, contracting your muscle, like either very fast or slowly. You can set also the pulse width. So everything actually can be set in the software for a good electrostimulation. And with the publications on the electrostimulation, it's also very clear that it enhances the performance of the, for example, sport patients, the strength. So it can be used in the sport, but of course it's been widely used in rehabilitation as well to prevent the atrophy by facilitating the muscle contraction, by selectively strengthening the muscles. So electrostimulation has its place in the physiotherapy. And I think that it's important to use it wisely, and it's a good way to work with the patient, right? So of course we should know the goal of our work with the patient and then apply electrostimulation accordingly. And there's been studies, for example, on the ACL patients when really there was this increase in the muscle thickness and the strength of the operated limb. So even using it early after the surgery makes a lot of sense. And the programs that are implemented in Stella in regards to electrostimulation already are pre-programmed with right parameters, right? So there is exercises like power trainings, active recovery, endurance training. There's a nice massage training as well. And there are also, there's electrostimulation for denervated muscles. So then if the patient has partly denervated muscles or denervated, you can use triangular or trapezoidal impulses. They are not very good, or they don't feel nice with the healthy muscles, but the denervated muscles, they will pick up them and stimulate them. So again, with the neurological patients, that's a way to work with Stella. And EMG biofeedback that you, I think, know quite good already. What is that? So basically, we can see the EMG activity on the screen on the patient. And the studies here also shows that it's an effective tool for neuromuscular eradication, but also showing benefits for patients with incontinence, with overactive bladder. So that means also we've implemented in Stella those programs, and they already have some tests implemented, like laser tests. There are also electrostimulation for pelvic floor disorders implemented in Stella as well. We've already pre-programmed electrostimulation for stress incontinence, urgent incontinence, mixed incontinence. So it's all there. And the preset EMG programs in Stella are the like 5 seconds of working, 5 seconds of rest, or 10 seconds, or quick flicks, or just a quick overview of what's going on. So whatever any of your customers are using, for example, Luna, to work with patients just with EMG, definitely it will be easy with Stella to do that, or easier even, because it's small, right? So you can take it everywhere. And there are games implemented, you know, most of them from Luna, so like Brick Pirates, Burger Mania, but there is also this game, Slice and Dice, whatever you're using EMG activity to make a soup. So you're cutting vegetables and you're putting that into the soup. So it's like a, you could say also something familiar for a patient, right? Okay. And the last but not least, the pain therapy, where we are using TENS stimulation for that. In short words, what the current is doing. There is this pain theory that whatever we are adding the TENS electrostimulation, it will like influence the neuron, the sensory neuron fibers, the type here, the one here, you can see, which is responsible for the touch, right? So vibration, proprioception, deep touch, all of that, those neuron fibers are responsible for conducting those sensations. And the C fibers are the pain fibers. So if the brain receives the touch sensation quicker, it will not analyze the pain signals. So we are kind of blocking the pain signals because they go slower comparing to the sensation signals. And you can see it also here in the table that they are faster with conducting those sensations. So we are kind of fooling the brain that it's only a touch, there is no pain out there. And based on this theory, we are using the TENS, and the publication shows whatever the application of TENS is happening, then it may lead to less pain medication use as well, right? Of course, we are not solving the main problem here, right? Which the pain is always a signal for something. So we should analyze where is it from and try to heal the cause of this situation. But again, it's better to use TENS instead of using medications. And also we can decrease the pain to take the patient through the active rehabilitation, right? So then we can really cure what is the cause of this situation. And of course, there are some good studies in regards to TENS therapy as well. And it's been shown that, for example, the TENS therapy was better than the placebo treatment in the patients where knee stiffness improved. And yeah, there's a quite big overview on of the TENS therapy. So, and in Stella, we have 4 programs for TENS. So it's a conventional one, frequency modulated, burst, and acupuncture. The main difference between them is basically the frequency of the impulses, and my personal favorite program is the frequency modulated. You should definitely try on yourself. It's delivering the impulses in the mixed frequency. So it's a very nice pain program. And summarizing all of that, who is Stella for? So basically, as we've seen, it's for neurological patients, and here we can try to apply it for stroke, traumatic brain injury, spinal cord, whatever we see the need for recovery, functional recovery, or working with the EMG. Here definitely is a place to try those with those patients. With the orthopedic patients, to decrease pain, to prevention of the muscle disuse, to strengthen muscles. So all those can be applied with orthopedic patients. As I mentioned, the pain therapy, so it can be the lower back, upper back, the joints, hand, elbow, all kinds of pains that can be treated with TENS. And with the pelvic floor disorders, as I mentioned before, there is the electrostimulation programs, there is EMG programs, there is a test for pelvic floor disorders. So with all those patients, you can also try to work through that. Okay, that would be the part for presentation. I will now stop the presentation and see if you have any questions. So I also have the Stella right with me here. So you can see again, it's a small suitcase. Personally, I'm using Stella with my computer. So then I don't need a pre-programmed computer. I just go for a website, and this is how I'm using Stella. Again, with this belt here, it's quite convenient. Okay, let's look at the questions. And the first question is: can patients use Stella Bio to receive treatment from home remotely? Probably was this question here. Well, the answer is we are developing the telemedical platform this part of the year. So at this point, this is dedicated more for the clinics and in a set that I've showed you at the beginning. So we would supply you with the laptop right away, with the one that we think is the best for Stella, and it will be pre-installed already on this laptop. In the second part of the year, we will release the software, whatever that the telemedical platform is already there. So then the patients could work with that remotely, being guided by the physio. But at this point, we are focusing mostly on the clinics. And even if we would like to go to the patients, then we would rather prefer the clinics to take care of the patients instead of giving away the devices for home. So at this point, like, let's focus on this, what is right now. We are focusing on the clinics. Okay. And why laptop, not tablet or phone? That's the second question. Well, at this point, we see that the software that we are having is best visible on this tablet, on this laptop, and we already checked this with this laptop, and it works nicely. I think in the further development, we can consider optimization for other devices. It is, when you're using the web version, it's already okay, right? But we don't know all the possible technical issues with all the phones, all the laptops, all the tablets, right? Because each of those systems have their own problems. So because it's not a application like from the store, right? Android or iOS, it's a web-based. So we don't know how it will look like on each telephone or laptop, right? So we cannot like tell you at this point, like it will work on everything perfectly. At this point, we know that we optimize it nicely for the laptops. Again, I'm using it on my phone sometimes, and it looks nice. I'm using it sometimes on my tablet as well, and it looks okay, but I cannot guarantee that it will look nicely on Galaxy, like old model Android or whatever, because we don't want to back it up with that we've checked everything. So for the clinic, the best solution is the laptop. It's nicely optimized. When you're entering the patient's data, is very comfortable because you have the keyboards. So because you need to choose one way or another, right? Either you're using it on tablet and then it's a little bit different. The UX is a little bit different, and on the laptop is a little bit different. So at this point, in Poland, in clinics in Poland, we are selling it with this dedicated laptop, and then we're sure that it's all good. The laptop or the device needs to have a Bluetooth as well. So we have this dedicated laptop that we know that it's quite also strong for the software that we're having for the device. And actually there is one more thing that I think it's safer if the clinic is using the dedicated laptop, because it's only Stella software out there. We don't know like how the software would behave in the clinic if like they would watch Netflix at the same time, right? So at this point, dedicated laptop is the safest solution, the most user-friendly solution. So that would be as long story short. So, okay, any other questions? Okay. Dries is question from Dries is that about the standalone software version, no internet, will there be an option to have HL7 connection to his? No. Is it possible to use Stella for speech therapy purposes? Depends what you mean. If you mean that you can use EMG for like face, and then you can see the activity, right? We will try to come up, because it's an open software, so, and it's all developed here in EGZOTech. So whatever we have a customer asking us for a special protocol, we are starting to work on it from the physiotherapy side, and then we are giving those information to the IT department, and they are implementing those. So we did receive the question about the use of Stella in oncology in regards to like swallowing. So this is something that we will try to work on and see how we can implement a special protocol, because it's just the protocols, and add it to the software later on. So from this perspective, we will be able to use that in this speech therapy, or more like a swallowing therapy, I would say. So, but you can send me an email also with more details, like what would you mean by that more, and we can look into this. Is it something that we can develop further? But not at this point, it's a EMG device, so then you can try to work with the patient based on EMG. All right. Any other questions? The best way to get to know Stella is, of course, to get a demo device, being trained online through our clinical team. Try it on yourself, right? Especially the EMG functional trainings, to see how like amazing feeling that is, and how we can really work with patient on that. In the company, we are using a lot of the pain stimulation as well, or massage programs. If anybody, have their pain during work, for example. So we have, oh, this is Stella, come on, let's try it on you. And it's, yeah, it's nice, it's helping a lot. The clinics are using Stella already, like for example, the denervated muscle programs are being used very nicely, and you can really see how the muscles, the denervated muscles are picked up by the current, or the EMG for pelvic floor disorders. And we are running some research on that as well with the university, and we will hopefully can have results this year as well. The question from Oscars is, will Stella be for sales or rental, as told before? Eventually, yes. At this point, we are mostly focusing on the hospitals in Poland. So we are selling the device as it is, as to the public hospitals, because the rental way is not always something that the public hospital can do. But in terms of the sales or prices, I will like you to contact Sergi or Milena for consultations, because this would be more like a sales strategy for your market and cooperation in terms of sales. Yes, but yeah, we are thinking about making it really like so each therapy office could afford that, right? So the rental option is something that this is something we are developing in Poland at this point as well. Okay. Any other questions? Of course, after the webinar, you can write down an email either to me or to Sergi with more questions that comes to your mind later on. And definitely the best option is to get a demo device and then have trainings, see how it works on your market, and then go from there. So I think the nice advantage is really the size of the device. Like I said, it's quite, and yeah, so that's again Luna, small sister. Perfect. Okay, so I think as an introduction, this would be more or less it. We have one more question from Harley. How do you differentiate the usage between Luna and Stella Bio? So again, with Luna, you provide the movement, you provide the support of the limb, you provide the passive movement, the resistance. So it's a robotic device that can do a lot. With Stella, it's a smaller device, so more portable even than Luna. It will provide functional electrical stimulation, right? So a different way of working with a patient. For upper limb, I think it's quite nice because it's a more functional movement. So I would say that they do different things and you need to adjust it to the way you're working in the clinic. I would suggest to have both devices, right? Or even couple Stellas. So that way you are able to take it to even patient room. Or if the clinic does not have space for Luna, then of course Stella would fit easily. So yeah, they are totally different devices, but triggering the same patient groups and providing, and this is what is similar for both of them, EMG triggered, right? So the patient needs to be active first, and then he or she will receive the either electrostimulation or the robotic movement. And I think that is something that is important in the neurological rehabilitation, that the patient is active, is having a lot of repetition, and basically that the motor cortex is being stimulated, and we can really work with patients on that. And evidence-based medicine on EMG triggered electrostimulation is very good. So we should use those research and implement it even more in the clinical field. And from a distributor perspective, I would say that Stella is easier to explain to therapists because electrostimulation is so well known in the physiotherapy field. It's a part of the program on the university. Is something that we usually use with patients. So you don't need to provide a lot of information on that because it just seems so obvious to physios. And having those pre-programmed electrical functional stimulation is just make it work more easy. And having the portable device that you can take to the patient is quite nice. So they're a little bit similar, but there are a lot of differences as well. Okay. All right, I think we're over 48 minutes now with our meeting today. Again, if you have any more questions, please write down to me or to Sergey, Milena, to have more information, and yeah, and we will go from there. Best is to try on yourself and see how it feels, and start cooperating with your customers to get the feedback, and yeah, and discover Stella this year. All right, wonderful. It was great to see everyone. Hope to see you next time as well. If you have questions, let me know, and we will see next time. Thanks, everyone. Thanks. Bye-bye.